So can you tell me what a breast biopsy is?
A breast biopsy is the process used to test that abnormality seen or felt in the breast to determine what it is. So it's the removal of a piece of that tissue, which can be in the form of a mass or a change in the skin, and is sent to the pathologist to analyze it under a microscope to determine what it is. And that biopsy is done in various forms. One of the forms is a core needle biopsy. It's often done by an ultrasound and a core needle, and the ultrasound is used in order for it to be guided so they can see the mass so the needle can be guided exactly at the location. When biopsies are done, a clip is remain at the location. So that clip, when the tissue is removed, that clip remains in that location. So anytime afterwards, any imaging that is done in that location, that clip will be seen so that the radiologist or the physician reviewing the imaging knows that that was the biopsy site. Another type of biopsy that is done is a stereotactic biopsy. That is often used for calcifications. And that type of biopsy is done where a woman may be laying down flat on her belly in a machine, and that is done via mammogram, kind of X-ray imaging as well. The other type of biopsy that is done is an MRI guided biopsy. And usually that is chosen if the lesion was found by MRI and was not seen by mammogram or ultrasound, then you will have an MRI guided biopsy. Another type of biopsy is an excisional biopsy. Some lesions, based on the location of it, it's difficult to have any of the other types. So therefore, the surgeon will go in and remove that biopsy. And the last type of biopsy is a sentinel lymph node biopsy, and that is done to sample the lymph node closest to the breast that the abnormality is seen. So that is just to determine if cancer has spread to that lymph node.